The challenge with trying to figure out how cannabis may be helpful for patients is one that palliative care clinicians struggle with in lots of different countries.
Clearly there's benefits from having this option in symptom management, so I see why not have everything available to us.
My feeling is that we have enough medication available for treatment of the symptoms associated with palliative care.
I'm neither in favour or not in favour. I feel that it does have a purpose and a role in palliative care, but I think it has to be very carefully monitored.
The challenge for clinicians is that we want to be able to make sure we're offering something that's helpful to our patients, but at the same time we don't have a lot of research information.
I think we need to do the evidence. I'm a doctor, I believe in evidence-based practice. If we can find a way in which any therapeutic drug, including medicinal cannabis, if it is effective, if it's safe, if it goes through the trials, and yeah, I'm more than happy to explore that.
At this stage I'm not in favour, probably because I don't know enough about it.
I definitely think there needs to be a little bit more research done in the area, as long as everybody's informed about what's being taken, so that the medical team are aware if there might be any kind of side effects and things like that associated with any other treatments.
It is a difficult dilemma, it's illegal at the moment. However, it is hard when there aren't really much in the way of trials.
We do have a lot of social attitudes around the use of cannabis and its associations with unwanted drug use, and we can't ignore those.
Just like any other analgesic or opioid, the potential for misuse or abuse is outweighed from the need of symptom treatment. So that's far more a priority in a person's seeking that medication rather than addiction or misuse of it.
I think people can get focused on what is working, which is great, but let that limit expanding what else could possibly work, what might be better.
I just think that it has such a potential for harm to society that I don't feel that there's a place in it.
We really do need to have the conversation and not shut it down because, oh my goodness, it's cannabis and therefore drug abuse.
If it proves to be therapeutic, I am definitely in favour of anything that would help pain management for paediatric or adult patients.
I have rhetoric and clinical experience that says to me, I don't know if it was coincidence or not, but I've certainly seen in a couple of families, it made the difference. And it made the difference to the child's clinical symptoms, but also to how the family felt about their sense of control.
If the evidence is there that it's not harmful, if it's something that people will find helpful on that basis, it seems like an entirely reasonable thing to try.
I think there's so much we don't know. I don't think we know dosing, I don't think we know the regime, I don't think we know the patients that are the most appropriate candidates. So I think it's really about the research for me.